Dr. Bains here. I'm talking about endometriosis right now, and the reason why it's so complex and so difficult to get it diagnosed. It typically takes a person around an average of 9 years to go from first having the symptoms to actually being diagnosed, or rather first seeking help to the time of diagnosis. So it's complex because it impacts so many systems. It's one of those things where hormones is one of the drivers, inflammation is a huge driver, and there are multiple other factors. And so when we look at it, we have to take a step back and look at all of this, take it into place and design a program for you. And so when you hear that it cannot be cured, it's not completely true. It maybe cure is not a good word. It can be managed. It can be managed to the point where your quality of life is not impacted by endometriosis on a daily basis. And this is what we're trying to achieve with a functional medicine approach and a hormone approach, bioidentical hormone approach to endometriosis. If you're watching this video, you've probably already been through the whole NHS route of trying to manage the pain, the exhaustion, the fatigue, the fact that you're losing probably half a month every month to symptoms of endometriosis that makes living a normal life quite hard. And you're managing, you're kind of just trying to get there, not quite there yet. So if that's you, you are the type of person who would really benefit from this. And at what age should you start to think about this? Well, there's no real age limit really. If your symptoms start early, start early. If you're perimenopausal, if you're in your late 40s and you're now hoping for menopause because in your head you think that everything's going to go away after menopause, that isn't completely true, because it's a disease that's driven by inflammation and hormones. So the hormones may go away partially, inflammation is still there, so the issue can still remain. Surgery, a lot of people opt for that. I'm not a fan of it because the uterus is there for a reason. I understand that in some patients it is an option because nothing else seems to work. But if you feel like you're heading towards there and that's what's in your mind, you're like, the only thing that's really going to help is if I take my uterus away, try a functional medicine approach first, because we need to look at your hormones. We need to try to balance them, and it is possible. We need to try to manage the bleeding, the heavy bleeding that happens all the time. We need to manage the inflammation. All those need to be managed. If you have all these things, your cells are not functioning well. They are exhausted, they're tired, they're not able to clear themselves up properly. Probably is quite poor, not because you're eating poorly, but because your cells can't absorb, your gut can't absorb. And these are the things that we see in our patients, in a subset of the patients that we see, where by the time they seek next level help for endometriosis, they have all these different elements coming together. They also start feeling a bit down and depressed. Who wouldn't? If 2 weeks of a month is gone every single month, it's not a nice way to live. And then, of course, fertility, that's another big one. Endometriosis can cause issue for fertility. It can also cause endometrial tissue outside of the uterus, which can then cause other issues like gut issues and scarring and all kinds of other things which arises from your endometrial tissues being outside of the uterus. And there are things that can be done about all of this, especially if you can start as early as possible. So even with scar tissue, even with scarring and all those things, there are things that can be tried, and that should absolutely be considered before considering anything like surgery or anything more drastic.